So the team became interested in ACP planning and religion and culture because of we were having conversations about the National Palliative Care Strategy, and also about ways that we could actually implement ACP in our organisation. We did a little bit of a literature search, and we found that there were lots of resources scattered across the media in various forms, but there was no one go-to place that had all of the elements of the cultural aspects of ACP planning and the religious aspects as well. We found that the cultural aspects were probably covered better, and religious aspects were quite poorly covered. So we saw this as a dearth, and because we're a Catholic healthcare organisation, we were really keen to explore this further. So in order to explore this further, we decided to start by putting in a proposal for some grant funding. The grant funding was through the Department of Health, and we were successful with that funding. That funding helped us to develop a project plan of how we were going to actually explore what resources were available and to develop an intervention to actually address the dearth that we identified. So we started off by doing a literature review, as all good projects do, and then we did an environmental scan, and the environmental scan showed us what resources were available in the community or accessible to the community and to healthcare professionals. We didn't want to reinvent the wheel, that's really important. What we wanted to do was to pull all of the resources that were available into one place so that people could access them readily. When you want to have an advanced care conversation, you don't want to have to spend 20 minutes searching through all of these different media to find the resources that you want. So that was our first task, was to actually identify what the deficit and the dearth was by the literature review, and then to do the environmental scan to find out what resources are out there and to pull them all in together. We developed a steering committee, an advisory committee of experts in religious leadership and things like that to help to inform the work that we were doing. And we used that information to help to inform our methodology moving forward. So the first thing that we did was, after we'd published our literature review and our environmental scan, was to develop a methodology to actually understand the religious leaders' perspectives and their needs, what the consumer wanted, what they felt that they needed to adequately represent their religion. We weren't set on what the website was going to look like. It took some time to actually tease that out, and the final product I think has taken a considerable amount of consultation. So the people that we worked with were health professionals, GPs, nurse practitioners, consultants. We worked with the religious leaders. They were the two major groups, health professionals and religious leaders, and then of course consumers, to find out what it was that they needed. From there we interviewed them, and we got the information that we needed, or the core content on which the ACPTalk website was based. We then had to make some decisions about the best way to actually present the information, and that was largely through the work of the steering committee, I think, and the advisory committee, where we talked about the different mediums that we could utilise, and it was decided that a website would give us the greatest reach. It would allow us to constantly update and to improve the resources, and it would also allow us to get feedback from the community, from health professionals, in order to continue this work, so that it's not a stagnant piece of work, but it's an evolving piece of work. So we built this resource because Australia is a multi-faith, multicultural country, And it's very difficult for health professionals to have an understanding, a broad understanding of all of the implications of the different faiths and the different cultures in relation to ACP. So we felt that it was possibly a barrier to having the ACP conversation, that people didn't want to be at risk of insulting somebody by mentioning something that may not be cognizant with their faith, that they felt that if they were prepared before they went into the conversation, that they were more likely to have more robust conversations about death and dying and ACP planning. So that's sort of the premise on which this project is based. The complexity, of course, is that all of the faiths are at different stages in their evolution and development, and people are at different stages in their beliefs. So, you know, you have some people that are practicing in the religion, some people that have a different cultural interpretation of the same religion. And that makes it really complex for us to try and understand. So the religious leaders were very important here. Their understanding of their particular faith and their particular culture was what we were trying to portray. It's not a one-stop shop in so much as we haven't represented every religion that's out there. That's something that we need to be very clear about. What we've done is try to portray the major religions that are in Australia today, but we do recognise that there's going to be people that are going to say, hey, my religion isn't there. The idea will be that there's a feedback mechanism on the site, and we're keen to continue to evolve the information that's presented on the site so that we can continue to explore other religions, other lesser known religions, and make sure that they're represented as well. The website content was informed by quite a rigorous process. 38 religious leaders were interviewed to help to inform the content. That then went back to the project steering committee, and the outcomes that were determined were then reviewed again by those religious leaders. We then sent the information to 19 representatives from organisations involved in culture and faith across Australia. In addition to that, we sent it to 22 other interested stakeholder groups. So next steps in the project will involve an evaluation of the uptake of the resource, and also of the feedback that we've received from consumers and health professionals about how we can improve the site. Those findings will be reported back to the Department of Health, and we will then make some recommendations of relating to the project and the evaluation. And I think that already we're starting to get some themes come through. It would be around ongoing sustainability of the website, how we can continue to incorporate new resources that evolve in the ACP space, but also to make sure that it's topical and continuing to address the contemporary issues that are current at the moment. The other thing that I think is important is that we should look at interpretation of other languages. And I think that the final thing is there will be other faiths that will be identified through feedback, I'm sure, and we'd like to explore incorporating those into the site. We've called the website ACPTalk because what we're trying to do is promote conversations about advanced care planning, about death and dying. We want people to feel that they can put their wishes on paper after consultation with religious leaders and their health professionals. And we believe that that is going to prevent some of the trauma that can occur in the latter stages of life. When people truly understand that this is their loved one's wishes, and those wishes are made explicit through an advanced care plan, there can be no miscommunication or misunderstanding. And that means that what is always going to be a stressful time I think becomes less stressful because families and health professionals know that they are actually doing what that patient wants. And that is the bottom line. That's what we're all here for. So I would just like to reiterate that the entire project really stems around the fact that we are trying to promote healthy conversations about advanced care planning, death and dying, and that we believe that you need to incorporate culture, religion, and other factors into this conversation.